My name is Dave Fredrickson. I'm the Executive Vice President of AstraZeneca, and I run our oncology business globally. Within that role, it means I'm responsible really fundamentally for two things. The first is how we think about which medicines we want to invest in and that we want to take through our research and development engine. And my second major accountability is delivering medicines that we have found in clinical trials to be effective across the globe. And so it's within that context that we're here today launching Cancer Care Africa to work on really making sure that we're able to improve outcomes for patients and have our medicines be a part of that. Our mission at AstraZeneca is to eliminate cancer as a cause of death. And in order to be able to do that, we need to make sure that the innovative and pioneering science that we have been so passionate about investing behind is able to reach populations across the globe. And here in Africa, we know that there is very much a rising incidence of cancer as a focus shifts onto non-communicable diseases. Africa is raising its focus on addressing cancer. We also, though, recognize that in order to improve outcomes for cancer patients, that there's a number of things that need to happen together beyond just bringing innovative new medicines. We need to raise awareness among patients. We need to improve access to early detection of cancer. We need to improve access to diagnostics in order to precisely understand the cancer. And of course, we need access to new medicines. The reason that we're specifically focused here within Kenya is that there are really outstanding partners, public and private, here in Kenya that are equally committed to outcomes for cancer patients. So the Ministry, National Cancer Institute, KESHO, the Hematology Organization, and Axios, all together with AstraZeneca, have put their collective effort behind Cancer Care Africa. And we really do know that it's that kind of partnership that's required to make meaningful progress against something as big and as important as cancer. So within Kenya, the three areas that we've begun our efforts on focusing on are breast cancer, prostate cancer, and lung cancer. And it's our aim to expand the centers of excellence that we work with specifically in Kenya on this. Already today, we've established 7 centers of excellence here within Kenya, focusing in on those sets of cancer types that I just described. We're also really proud to say that within those 7 centers of excellence that we've had an opportunity to donate ultrasound-directed biopsy machines within each of those. And I think that that's really important to driving the precision diagnostics, which I had spoken about before. And then equally importantly, we've begun to establish testing that's local testing here within Kenya. And the reason that local testing is so important is that testing is something that needs to be done precisely, but also in a timely fashion. And it needs to be done in a cost-effective way. And by doing it locally, we're able to actually do it with high quality, in a rapid turnaround time, and in the most cost-effective manner. And so we've been really pleased to see the progress that's being made in building up that capability and capacity here within Kenya. And really, at the end of the day, a huge, huge area of focus for us is about capability and capacity building around those areas of awareness, detection, diagnosis, access to medicines. Yeah, really the primary areas that we need to make sure we're focused on first, patient awareness. Patient awareness is so important. It's critical that people who are living their day-to-day lives continue to have regular visits to their healthcare practitioners, particularly those who have risk factors. Cancer, when it's diagnosed late, unfortunately does not have very good outcomes. And so as a result of that, it's important that women who are at risk for breast cancer, men who may be feeling signs and symptoms that could be early signs of prostate cancer, that they really have the awareness to be able to come and talk to their healthcare practitioners to understand whether or not they may have, in fact, an early detection that can take place. Having also the capability and capacity in place to do the early screening, to do the precision diagnosis, and of course the access to medicines if in fact a patient is diagnosed with cancer. And we're working across all of those elements with our partners here within Kenya. Some of the primary barriers that we need to work through, and I mentioned a few of these before, but we really need to make sure that we're working together with the ministry, with the NCI, with Kesho on raising awareness with patients, with broad campaigns, with objectives to reach as many patients as possible. Secondly, we need to make sure that for early detection that we're leveraging wherever we can artificial intelligence and new technologies to be able to deliver cost-effective approaches to early detection. And if we pair that together with awareness, those are ways that we know that we can actually really have even more high impact from the work that we do. Localizing testing, which we've already begun to do, is another way to address the barriers that are specifically faced here within Kenya and frankly throughout the African continent. By having local testing efforts, it's both high quality, more precise, and cost effective. And then lastly, in terms of access to medicines, we're really proud of the innovative programs that AstraZeneca specifically has put into place to tailor our affordability programs to meet the personal needs of patients through a very innovative cost-sharing model. So if I think about the continent broadly, our ambitious goal across the African continent is, through the course of Cancer Care Africa, we would like to establish 100 centers of excellence. We would like to have over 100,000 HCPs that are trained and built through capability building. And we'd like to see 1 million people across the continent screened for cancers. And I'm confident that if we're able to achieve those objectives, of which Kenya is one of the foundational and core countries that we're working in, that we can start making meaningful progress in improving outcomes for cancer patients here within the country. Here within Kenya, as you mentioned, NCDs are on the rise. That's true across the whole continent. And I think that it's really important to recognize that a focus on NCDs is really key to having a healthy society, and a healthy society is really critical in order to having a good, thriving economic society and country. New medicines that we're focused in on. We have an innovative lung cancer medicine called osimertinib that we have for a specific type of lung cancer that we've been working with here within Kenya. Medicines within prostate cancer, breast cancer. These are our areas of focus, and we have medicines that are innovative, pioneering medicines in all of these areas. And we are really bringing those medicines into the partnerships that we're establishing here within the country. Cancer Care Africa is a program focused in on all of the elements that need to come together in order for us to be able to improve outcomes for patients. It's awareness, it's detection, it's precision diagnosis, and it's access to medicines. And the partnership that we have together with our Cancer Care Africa partners is focused in on making improvements across all of those dimensions. Because if we are able to do well on all of those, we know that patients who are living with cancer will improve the most. Specifically on access to medicines, we're really proud of an innovative program called Nuru that we have brought here into Kenya. It is an innovative cost-sharing model that tailors the level of assistance that we provide to patients based on their ability to pay. Those are the kinds of commitments that AstraZeneca is making here in Kenya in order to make sure that patients can benefit from the medicines and get the best possible outcomes. An enormous part of the work that we're doing is on capacity and capability building. As I mentioned, here within the continent, we aim to have over 100,000 healthcare practitioners that are able to go through training and really enhance their skills and capabilities. Also here within Kenya, it's been exciting on my visit to meet with some of the outstanding healthcare practitioners at some of the leading centers here within Kenya, and we look forward to continuing to work together with them on research and efforts that can advance the science both here for the country but also for other parts of the globe. Cancer Care Africa we initiated in 2002, and it is absolutely with an intention for it to be a sustained effort. It's critical that it have partnership with the ministry and with Kesho and with NCI and with Axios. And I would say so long as we have 5 partners who are interested in continuing to sustain the effort, AstraZeneca will be interested.